The following audio may contain the personal testimonials of some Optavia coaches or clients of Optavia. The results relayed in these messages are based on the unique experiences of the participants, and we cannot guarantee like or similar outcomes. While you may be inspired by these accounts, please note that any stories of success have not been verified, and your individual path to optimal health will vary. As always, it is our recommendation that you consult with a healthcare provider before starting a weight loss program. Yours in health, the Optavia team.
All right. Well, welcome everybody that just joined in for National Optimal Health Day. We're so glad that you're here. We are excited about celebrating the 5th annual National Optimal Health Day. This is a powerful day where we bring communities together. We celebrate the opportunities that we have to create optimal health and well-being in our life. And we have a special event for you here tonight. This is going to be an exciting opportunity for you to meet one of the pioneers and the innovators in the concept of creating optimal health and well-being, Dr. Wayne Scott Anderson. And Dr. Anderson has brought along a couple of transformation stories, real people who have been following the process of creating health in their life, and they're going to get a chance to share their stories. Maybe some of you already know who Dr. Wayne Scott Anderson is. Dr. Anderson is one of the nation's most foremost physicians in nutritional intervention. He's also the best-selling author of the groundbreaking book, Dr. Ray's Habits of Health, and the New York Times bestseller, Discover Your Optimal Health. Dr. Wayne Anderson has devoted his career to forging new territory in the realm of creating optimal health through a comprehensive approach, and he addresses this through logistical and psychological strategies to overcome the barriers that you're facing. His desire and knowledge for understanding drove him to become the first in his family to enter college and graduate with honors from the University of Florida with a degree in science. Ultimately, he went on to medical school at the University for Health Sciences in Kansas City, where he was the valedictorian of his graduating class. Dr. Anderson did his internship at the Grandview Hospital, where he was selected the Outstanding Intern of the Year, and he was to become the leading internal medicine specialist in cardiology or pulmonology, but decided instead to enter the emerging subspecialty of critical care. Dr. Ray is trained in open heart surgery at Cleveland Clinic, and then he went on to train for 2 years at Jackson Memorial Hospital at the University of Miami. And that program is considered to be one of the most premier training programs in the country in surgical intensive care. Dr. Anderson became the 10th physician board certified in critical care and went back to the institution where he began his postgraduate training to set up the open heart program in surgical intensive care unit. It was there that Dr. Anderson developed a profound understanding of the pivotal role that nutrition plays in disease and in creating optimal health. For 18 years, Dr. Anderson directed the surgical critical care program at the Grandview Institution and was the chairman of the Department of Anesthesiology. In 2000, he made the monumental decision to leave his hospital-based practice to devote his full energy to helping people to become and stay optimally healthy. He's now the co-founder of Optavia, an organization that is in the emerging specialty of health coaching, and he serves as the medical director, and he's also a reviewer for Critical Care Medicine Journal in the area of nutrition, where I'm so proud and so honored to be able to hang out with this healthy lifestyle rock star. You can see him here on his boat. He is living an optimal life, and it's our pleasure to be able to hear from him tonight on the 5th annual National Optimal Health Day. Welcome, Dr. Ray.
Well, thank you, David, and I appreciate those warm words. It's pretty exciting to have partners like yourself. I've watched your transformation for how long has it been now? Like 7?
8 years.
8 years. 8 years, and I've watched you grow so much. You know, you were very, very accomplished in your specialty as a financial advisor, and I've just watched you the morphology change and physically and mentally, and just your spirit, and now all you're doing to help us on this mission to create a healthier world. And so I'm excited. National Optimal Health Day is a very, very important day to me. It's a day where we have an opportunity to reach out to our amazing country and you know, in the not too distant future, the world, on this idea of that we can make a change in our health and our well-being. And so for so many, you know, they're kind of locked into their story. You know, and as you mentioned, I was a critical care physician, and I took care of people that were very, very sick. And I was really proud, and I trained in one of the best places in the country. And helped pioneer that specialty, but I never really helped anybody get healthy. I simply kept them from dying. And, whether it was the young kid that was in his beautiful new Camaro that wrecked, and he wasn't worried about his material Camaro, he was worried about living, or the executive, he wasn't worried about his portfolio, but just wanted to live another day. I realized that those moments that we're at and those things that occur are not just from that moment, but they're all the choices we make throughout our life. And one of the crazy things, and one of the things I like to use as an example, is the medical delivery system of our country has been taken over by business and the healthcare galaxy. And physicians are no longer just the person taking care of their patient and being able to be there with the time to really educate and be there as a partner with their patient. Instead, the business of medicine is reacting to disease, selling more medications, and unfortunately is not really helping anybody get healthy. So I'm really excited that I was able to move upstream 17 years ago and start focusing on making a change in people's lives. It's been dramatic. It's been unbelievable. Just looking at yourself, and most of this 30-minute session is going to be about celebrating some of the evidence base, because medicine is about evidence base, and yet only 45% of medicine is actually evidence based. A lot of it is the art of medicine. So there's a lot of things we do, and looking at the statin drugs used for cholesterol reduction. Well, unfortunately, those that are on those cholesterol lowering drugs, statin drugs, are more likely to be overweight and more likely to eat unhealthy and not exercise, not sleep well, not handle stress well, because they're using it as a crutch. So tonight we're talking about a very different thing. It's not about dieting. It's actually about how you can awaken yourself to make the choice to change your story. We're going to bring on, in just a moment here, 4 amazing stories of people that have transformed their lives. And what we do is we awaken people. We give them a coach, somebody that can basically has probably been there before them, and now is there to help guide you along the way. Second is we use the Habits of Health, which David talked about, which is a comprehensive system that I've developed over the last 17 years. That's a blueprint to help you wherever you are now. 70% of us are overweight or obese, but even for those that are at a healthy weight, helping you learn the things that not only allow you to optimize to be as healthy as you can be at whatever age you are, but to continue that for the rest of your life. And we have people in their 90s and even a couple in their 100s that are using our system. The third part is this community. It's the people on tonight. We have over 1,500 people on tonight, and many of you on tonight have been brought here by someone that cared about you and wanted to really turn you on to a way that actually works and helping create lifelong transformation. So I'm pretty excited about that. And last but not least, some of the tools and strategies. I came in 2001 to this parent company called Medifast because they made meal replacements which were very efficacious for people to lose weight. They didn't teach them lifestyle or how to eat healthy. And so over the last 15 years, we've really developed that within the Habits Health system. So now we use the fuelings as one of the tools in this process of starting people on the path to reach a healthy weight, but much more than that, as they awaken and they're really excited because they have more energy to sleep better, to handle stress, and all the components necessary. And when we take our Habits Health system, our community, our coach, and our feelings and put those things together, that puts you in the best position to have lifelong transformation. So what I want to do now, rather than continue on talking, is really bring on 4 stories of people that are in that process of transforming their lives. First, I'd like to bring on Jody Genesee. Jody, are you there?
I'm here.
Well, how are you doing tonight?
I'm doing fantastic. Thank you. How are you doing?
Fantastic. It's great to have you. I love to hear you smile. I got an opportunity at our national convention this past summer to really celebrate with you, your incredible story of transformation. I know it's been about 18 months and your whole world has changed. So I think it's important, the transformational stories are the evidence. And so really, let's talk about that. Tell us about what happened to you and where you are now in your life.
Yeah, thank you so much. So my transformation story actually started with me being a morbidly obese man on an airplane. I had the seatbelt extender on me. I was sitting down next to a normal sized guy and I was trying to, get out of his way. So I was leaning away from him. I was spilling into the aisle. All of my body was miserable. The sides were hurting from the armrest. My neck and back were hurting from leaning away. And I decided I need to dig deep and really just evaluate what was going on in my life, and specifically what it was like to be the fat guy on the plane at that moment. I'm a writer, and so I started typing on my iPhone and just some feelings of what it was like to be the fat guy on the plane. And it really reflected what my life was like overall. Miserable. I mean, everything was hard. Putting my clothes on was hard. Walking was hard. Sitting in chairs was hard. Breathing was hard. And so I knew after that airplane and after exploring those thoughts that I had to change. Thank goodness my wife had come across this program, and I was reluctant. I was a little bit skeptical, but I thought, okay, I'll give it a 1-month shot. Within days of starting this optimal health program, things clicked. I loved everything about it. I started feeling better. As time went on, everything about my life got better. It was like somebody showed me where an on button was for my body and my soul. And even simple things like one day I was walking to a gas station. I looked down and my shoe was untied. And I bent over it to tie my shoe. And all of a sudden I'm like, I just tied my shoe. Now, if you're not a large person, you don't understand how significant that was. But I felt like I was Rocky in that parking lot. I was celebrating. A couple of weeks ago, it's been a while, and things just keep getting better and better. I decided to take my 4-year-old, 8-year-old, and 10-year-old behind my house. I live in the Salt Lake Valley. We overlook the valley. We walked up a mountain, and we went on this wonderful hike together. It wasn't a big mountain, but it was a big moment for me to experience life as a father with my children and to be active and a good role model for them. And just everything, from the simple things to the big things like that. The attitude, my mind, my body, everything is changing. I just love this program so much. It gives me the tools, the system. There's so much support. I have the great guidance of a coach who helps keep me accountable and gives me personalized guidance and support. I have the wonderful Habits of Health system, that education, the strategies that help your body and your mind, the nutrition, scientifically formulated and really delicious, by the way. Thank you. Really makes it simple. I have a wonderful relationship with food now, healthy whole food, and that's another great component of our program. And maybe the biggest thing for me has been the support of the community that I found. It's like a second family. Some days I'm helping them, other days they're helping me. They inspire me, I inspire them. We go through these struggles and these successes together. We're stronger together. We're better together. We succeed together. So overall, now I've lost 166 pounds. I love what I've gained more than that, though. I've gained a better life for me and my children. I've improved my health. I have a better attitude about life. And I have a path for lifelong transformation. And you know what the best thing? I have hope.
I love it, Jody. And, just the ripple effect that you're having throughout the country and very shortly throughout the world is that we're going to change the world, because as we change from within and then reach out to others, that's how things really happen through the grassroots approach. So thank you so much. It's an inspiring story, and I can't wait to continue to watch it. Okay, want to move on now to Brittany May. Brittany, are you there?
I am. I'm here.
Brittany, one of the great things about first getting to see you, you were down here in Annapolis last year, and I just saw the sparkle and just this amazement as you are on this journey. And it's been, I've got to watch you over this last year. And the other day, when I was picking out, God, who would be great stories for everybody to listen to, just to really get an idea of what's possible. I just kept thinking about you. And starting off, you had this milestone where you're now less than half of your former self. And that's in what, 15 months?
15 months today, actually.
That's not usual. We can't make claims that can necessarily happen. But the bottom line is what's exciting for you in your story is that you're changing your health, your life, and it's a whole transformation.
So one of the things I love so much about this day is just, as Jody had said, the hope that we can bring. And whenever you're 500 plus pounds, there's not much hope. I had landed my dream job. I teach high school agriculture, and my students are part of my biggest cheerleading team. But I was their limiting factor, and that wasn't okay with me. I was saying no to events that they weren't going to be able to attend. I wasn't able to fit behind a steering wheel to drive a car to get them to events, I was the reason they had to say no. And again, that wasn't okay with me. But 15 months later, 260 pounds down, less than half of what I was in the beginning, the hope and the knowledge of knowing that I'm not going to go back to where I was because I have this support. Every day I'm finding a new ability, whether it's buying one plane ticket instead of two, again, being able to fit behind the steering wheel and sitting in a waiting room with arms and chairs and not thinking twice because I might not fit in the arms between the chairs. And who would have thought me, used to be 500 pounds, would be an inspiration or would be able to be that source of health and positivity for my students? It's every day is a pinch me moment. Every single day I find something new, and I just know it's only the beginning.
Yeah, I love that, Brittany. And, just to make sure, I want to be clear on that is, we can't make claims on how much weight someone's going to lose. And obviously yours is personally to you. But what we can say is that you're in the process of transforming. And the weight was just one small little piece of that. It's the gaining your health. It's your ability to function in what you do in your vocation with your kids. It's just seeing the amazing, again, I have to go back to the ripple effect that you're having on so many. I can see the board lighting up in the chat room about how amazing it is just to watch the possibilities. And, just statistically, less than 1% of people that have the kind of weight that you have actually ever even reach a healthy weight, much less keep that weight off. And I think the key part in lifelong transformation, which is what we're about, it's not about just what you're eating. It's not about any specific diet. It's about fundamentally your lifestyle. It's about having support, having a lifestyle plan for that, being around like-minded people, and all those things you're doing in such an amazing fashion. So I want to congratulate. I'm just so proud and happy for you. So moving right along, I want to go to Nancy Strauss. Nancy, are you there?
Yes, I am here.
Well, Nancy, your story is a little different. Obviously both Jody and Brittany had considerable weight to lose, which is an important part, which is always exciting. Your transformation, I know you have that one picture you showed me a long time ago. It looked like the Yeti because it was the graininess of the film. Like all I could see was the shadow. But I know clearly, you also had a pretty significant physical transformation. But beyond that, as you've started reaching and now reached your healthy weight, so much more has happened in your life.
Oh goodness, when I think back, Dr. Ray, 5.5 years ago, I get really emotional and sentimental about it because the contrast between then and now, it is staggering. It's just a whole different life. 5.5 years ago, I was a hairstylist on that hamster wheel, working really hard, sacrificing time for money, broke. In fact, we were losing our house. We had our house for sale twice in 1 year, obese, and I had a lot of pain. I was also that diet queen. My clients were always used to hear me talking about dieting. If I wasn't on a diet, I was talking about dieting. I was famous for losing the weight, but yo-yoing, gaining the weight back always, and always in search of that magic pill that doesn't exist, But everything changed for me where I was really ready to change my life when one day I didn't fit on a roller coaster, and I was shocked that I was that person. I really needed that wake-up call. I didn't realize how big I had gotten. But that was very much an eye-opener for me. And so I called one of my hair clients who was a health coach, and she helped me lose 54 pounds and go from a size 20 to an 8. And I am so eternally grateful. I got my life back and I felt so good. When I started this program, though, I really thought this was all about diet and, learning the lifestyle, which, that's a big part of what we do, of course. I loved having the free health coach. It's so relational. I love learning the habits of health and, changing my life. But what was surprising to me is how it started to work with this stuff, the mental stuff. I learning my triggers that cause my behaviors. And that's really key if you're going to have lasting results. I found that I couldn't keep it quiet. So I was sharing with everybody, and the salon clients were like, what just happened in the past few weeks? They were like, sign me up. So I became a health coach early on. After only 3 weeks of being on program, I decided to coach. And what I found is that we're not just healthy body. There's so much more to the picture I didn't even know. It was, you know, a lot of the changes you can't see. It's what's happening in here. So I love the healthy mind piece. It really started to unfold, and it's stuff I didn't realize, that when I bought that coach kit, that I was actually buying a self-development kit as well, and learning always to be a better version of myself as I pay it forward and help others, keeping them accountable, which is also keeping me accountable. I've developed such amazing relationships. People have become family. I love our community so much. Learning how to quiet that inner critic, you know, the fear and the doubt, just shutting that voice down as you know, focus on others as assisting them to health. It's been so rewarding, you know, getting the love notes from the clients with such gratitude, like I'm wearing my wedding rings again, or I'm able to play with my grandchildren and I'm not winded. Hearing that every day, it's just the fulfillment that comes along with that is just off the charts. You know, learning how to handle stress better, the confidence that builds. It's now a life of abundance and freedom that I never even thought was possible. This is beyond my wildest dreams. You know, I'm able to travel now, and I coach from the beach all the time. It's such a portable business. I can take it anywhere. And I was actually able to retire from the salon 2 years ago. This is my favorite makeover. I love this so much. And I'm really looking to possibly retire my husband within the year. So that's exciting to me. It's a bigger life, you know, mind blown. I'm dreaming again, and the purpose just keeps growing and growing. This is the best kept secret, but it shouldn't be. So that's why I'm sharing today. Thank you so much, Dr.
Very awesome, Nancy. You're a great inspiration, and just your smile and everything to watch your transformation. You know, the great thing is I get to watch all these incredible people really start fulfilling their potential. You know, one of that inner critic that you kind of mentioned annihilates the potential for so many people, and to watch you basically, you know, blast through that, and now you're out helping somebody else. You know, when you put the emphasis in helping others, you don't really have time to be thinking about, you know, woe's me, right? So it's great to see what you're doing, and that you're helping us change the world. So excited so much for you, Nancy. Thanks. Okay, last but certainly not least, our fourth is Lisa Castro. Lisa, are you there?
I am, Dr. A.
Well, Lisa, it's great to see you. And I know you guys, I'm glad everything worked out okay down there. I know you're down in Florida during that storm. And I know the last 15 years, 14 plus, have put you in position to have the resilience to be able to handle whatever life, you know, throws out there, you know, because life isn't fair. Life is intrinsically unstable. And so for us to work from the inside in, and I've just watched you for 14 years now grow from someone that is, you know, really struggling with your health, and now to be not only a great leader, but also just an incredible example of what the potential is when you make a decision, use the habits of health and be part of a community, and then work on helping first yourself and then others. So tell us about it, please.
Oh gosh, thank you, Dr. A, for this opportunity to share, because I actually would love to forget about my past. But that past has made me who I am today, and I want that story to be able to inspire others this evening. And I so hope that when you listen to the story, will you please allow me to connect the people on the call here, if you could allow my heart to connect with yours, and then engage your imagination. I'm going to take you back to what it was like living in the life of Lisa Castro's body and her mind. I don't know if we really want to go there, but it was June of 2003. It was my 43rd birthday. I'd been struggling with so many health issues for 12 years and seeing one specialist after another, and the list kept getting bigger of the things that were going wrong with my body physically, but also at the same time emotionally and mentally and relationally, and lack of experiences because I was hiding out as a hermit. And during that time, I'm thinking of the times my husband would come home from work as a police officer, and I was so moody from eating chocolate all day, and my blood sugars were all over the place. And I would say, I'd get bothered about the littlest thing, and he'd find himself going into the bedroom and shutting the door and watching TV just to get a break from me. And that's a pretty sad state of affairs. We'd been married at that time for 23 years, and wasn't doing well with my kids. I'd let all my friendships go, except for one that was my diehard friend, because I just felt so tired and I felt ashamed of the way I'd let myself go. And that very morning of my 43rd birthday, I remember trying to set myself up in bed. and my elbows gave out on me because my joints were just killing me, and my pain in my muscles. And besides that, the fatigue was horrible. And then I was having some neurological issues that were making it really hard to even think or concentrate. And just getting through a day was just about surviving. And I remember sitting up, and I remember falling back into bed because my elbows gave out on me. And I remember propping myself back up, and tears are streaming down my cheeks. And I said out loud with conviction, this is my birthday present to myself, I give up. I'm going to be overweight, unhealthy, and unhappy for the rest of my life. This is just as good as it gets. And I knew it was even going to go downhill from there. Fortunately, my sister-in-law and brother cared so much about me that they shared this program with me. And that day I say that they gave me hope. I thought they were offering me a way to lose weight. And I thought, at least that's something I can do. And I just resigned myself that I wasn't going to do that. But when I saw my sister-in-law, I thought, okay, one last chance. I'm going to give it a no matter what commitment. I didn't care what it involved. I wanted change. And so I did that no matter what commitment. And within just a few days, it was amazing how much better I felt. I had more energy than I'd felt in so long. I was eating healthy. I was eating healthy foods instead of chocolate for most all my meals. I started having the energy to get out and moving. I actually went whitewater rafting 2 weeks later with my health coaches and some other friends. And I thought, wow, even a social life, even a relationship. My husband was there. And it's like the life started opening up to saying, what else is possible? And I started realizing, maybe I could start exercising again. And it didn't put me in bed. That was amazing. And then pretty soon I was doing strength training, and then I was starting to actually be on the phone more. I was still hiding as a hermit. There wasn't Facebook back then. We're talking over 14 years ago. But what ended up happening is more and more possibilities opened up. I started, just like Nancy, I started helping other people. And that in turn helped me move forward on my journey, because I knew I was making a difference, bringing meaning and purpose in my life, as well as helping other people do the same. It took me 4 years to get out of my hermitness. And that's the part where, about that time, Dr. A was introducing the habits of health. And I started implementing more about the healthy mind. And I was so grateful for his stop, challenge, choose, and incorporating that healthy lifestyle one habit at a time and saying, what else could I do? And over time, it has turned into a life of jumping out of an airplane for my 50th birthday, rappelling down cliffs in Cancun. Matter of fact, with Dr. A, and it's been a few years for that. And then being able to snorkel with a super pod of wild dolphins, going jet ski on a regular basis. My husband and I live between Oregon and Florida. We call ourselves Florigonians, and get to be with family in Oregon. And we get the lifestyle of Florida. Matter of fact, this morning I was out on the beach and doing my power walk. And then afterwards went swimming in a pool with some friends of ours from Washington, and they're visiting us and just hanging out and talking. And still, as Nancy was saying, lots of opportunities to still work with people that we care about, spend time with people we care about, while all at the same time creating the life that we want. Not only did my husband and I end up improving our relationship, we actually renewed our vows 2 years after starting our program, and now we're at 37 years. And Dr. A, I have so much to you to be grateful for, and the life that we've chosen. But it really, like you said, it takes us making that decision. We can put it all out there to give somebody away, but if they don't take it and realize it's possible, I'm hoping that I evoked possibilities in each of your minds tonight of saying, what can I do? How could I move forward? What am I willing to do to get there? So we can be that better version of ourselves, so we can in turn, hopefully inspire others in our lives. So that being said, Dr. A, I would say the way to sum it all up is I went from feeling like a victim to a victor of my life.
Awesome.
Thank you.
Lise, great, awesome job. And it's been amazing to watch you and your changes. And, a lot of it isn't just the physical change. It's the change in your spirit and your love for people. And like you said, getting out of your own way and moving forward. And so, what's really interesting on all 4 of these transformational stories tonight, whether it was Jody's or Brittany's or Nancy's or Lisa's, they're all starred with I can't. They'd given up. They thought they were stuck. And for many of you tonight, you may be feeling that same way. And we know, I'm sorry, I'm getting emotional, but the world is such a mess, and so many people are so right now struggling in their lives. And maybe you've tried before and it didn't work. And maybe right now you're thinking, well, I don't know if I can or can't do it. The answer is you can do it. And it's just making a decision. You can change your story, just like the 4 stories you heard tonight. Wherever you are now, you can make a difference. And I can tell you that when you can get up every day and you help transform people's lives, and you can live for future generations to have a better place to live in this world and be able to take care of themselves at a time when the world, unfortunately, is changing at such a level that if we don't have the mentorship, we're not going to be successful. So whether you start with helping one person, which is yourself, or you decide to join us and help us change the world, let's go out and make National Optimal Health today, not one that 1,500 people see, but one that can be part of a celebration that we've changed the world and made it a better place for people to thrive and enjoy their families and put there for our future generations. So God bless. Have a great night. Good night.
The following audio may have contained the personal testimonials of some Optavia coaches or clients of Optavia. The results relayed in these messages are based on the unique experiences of the participants, and we cannot guarantee like or similar outcomes. While you may be inspired by these accounts, please note that any stories of success have not been verified and your individual path to optimal health will vary. As always, it is our recommendation that you consult with a healthcare provider before starting a weight loss program. Yours in health, the Optavia team.